Hi, this is Jerry Cahill. Today you'll meet my CF medical support team that have had a major impact on my life with CF and my double lung transplant. Besides being my team of doctors, they've become like family. An educational grant from Gilead helped make this podcast possible.
Well, from a medical perspective, CF care is very complicated and integrated, so patients really need help sometimes in figuring out their day-to-day routine. There's a lot that needs to be done every day for a patient with cystic fibrosis to stay healthy. Well, I've known Jerry probably for 10 or 15 years. He is somewhat unique. He's very proactive, he's very aggressive in his care, he expects a lot from his care team, and rightfully so. So it's really been a pleasure knowing him in that regard.
So I've known Jerry since almost my first day here at Columbia, since 2001, so it's almost 15 years. But even at that point, we became engaged as partners in trying to figure out what the best route for his care is.
Jerry Cahill is a wonderful person. He is, I think, he's an older patient, so he doesn't fit the norm to begin with. So we're all amazed by, how well he did before transplant. It's amazing that he did not get transplanted until into his 50s.
He follows all the directions to the T. He does ask questions if he has any. We actually like that in patients. And he's also very cool about his care. In other words, if we tell him that he's going to need to get a bronchoscopy tomorrow, he may complain for 2 seconds and then say, "I'll be there." So I think in that sense, he's a role model.
Well, first and foremost, I try to always be accessible to patients, particularly when dealing with a serious chronic illness. It's important, I think, that patients can easily access their physicians and other providers on the team. I work with patients both for their medical needs, which tend to increase as patients get sicker over time in some cases, and also with their emotional needs, getting family members involved when it's appropriate, getting the patient, perhaps if they need psychological care for support, helping them access care that they need to get through the difficult process.
My role for a support person for threatening diseases or surgery or avoiding surgery is to let them know that whatever their problem is, be it medical or surgical, we can deal with it. And it's a matter of lining up the support, lining up the patient and the patient care team to make it so that we can get them better.
My main role in the evaluation and management of patients with advanced lung disease is to first assess their eligibility and try to figure out if there are any medical issues that we could address.
It's not a single-handed work, it's a team effort. But the people that you meet, the experiences that you have, I have learned so much from the patients. In so many levels, and I'm very fortunate to have this job and be able to give the care that I do give.
I mean, just by definition, we know patients very, very well. I mean, I've had many patients since I was a young doctor for about 20 years now, and the guidelines are that you see patients every 3 months. So if you do the math, you really get to know patients very, very well. You get to know their family members.
The special bond between patients and myself and family is because we're their lifeline. The transplant center is their lifeline. And the more they understand that, the more closer they become.
Jerry allowed us into his lives early in terms of helping him make decisions and get better, and likewise it comes the other way. So we've gotten very close to Jerry for a long time.
We get comfortable with each other, and patients really feel comfortable reaching out to their provider, not being concerned about intruding on time and so forth. We really try and let them know that we're treating them as well as we would treat our own family member, and we want to be accessible to them and available.
I'm very glad to hear that Jerry calls me part of his family. That's very nice to hear.
In working with Jerry and really in all patients with CF, I think it's important to work with patients within their lifestyle, with their day-to-day activity, and really keep them as healthy as possible. It's really important in CF to have at least a support person. In fact, as a provider, if a patient comes to all of their visits alone, I do urge them to bring somebody with them, because doctor's appointments sometimes can be stressful. There's a lot of information that goes back and forth, and my sense is that when patients leave the clinic, they often forget a lot of what we talked about, or they don't feel accountable. For example, nobody was in the room with them to hear that they need to increase their treatments to 3 times a day, or they need to be hospitalized next week perhaps to start intravenous antibiotics. So I, as a physician, often urge patients, not all the time, but sometimes, to bring a support person with them, just to kind of have a sense of what is going on in their health, and really to be accountable not only to their medical care team, but also to their own personal support team.